So I think as parents are thinking about their kids going back to school, I realize so much to think about, and I can sort of walk through some of the things that the school that my daughters are going to are implementing to try and ensure the safety of the students and the staff, and things I think that parents can ask questions about and think about as their kids going back to school. We are blessed in that the school has the infrastructure and the space to be able to, we're going to start with a hybrid model for about 3 or 4 weeks, with essentially kids having 3 days in person and 2 days at home doing remote learning. And the point of that is that the fewer kids there at any given time increases the ability to space out desks and tables and give close to 6 feet between students at any given time point. In addition to that, the school is requiring masks, which is mandated at the state level for all schools as well. But I think it's really important for parents to think about that, adhere to it. As best, the vast majority of children can wear masks. And I think the mitigation strategies of physical distancing and masks are clearly the most important thing you could do in a school setting. And teachers obviously have special concerns, or many of them are more concerned because they tend to be, they're older by definition. Some of them tend to be even at a higher age that may be at risk for severe disease over the age of 60 or 65. And many teachers are talking about wearing masks plus a face shield. So at minimum, they should be wearing a mask. And there are some special situations or special circumstances where I've advised teachers, if it makes you feel more comfortable and it's okay in the teaching setting, comfort-wise, and if it's not too hot, to wear a face shield over the mask as an extra layer of protection. I think that is reasonable. I can't really give them a number on how much more protective that is, but something that I think is worth doing if it makes a more vulnerable person feel more secure in that setting. So in addition to the physical distancing and the facial coverings, other things to think about or ask your school about: what are they doing with lunch? We've talked a lot about lunches and trying to not have kids congregate in the lunchroom. Our school is not using the lunchroom. The lunch will be delivered to classrooms. That's not possible everywhere, but something to ask about is, how are you staggering lunches? How are you utilizing outside spaces for kids to space out? Because people should recognize eating is an especially vulnerable time because our masks are going to come off, and there are examples in healthcare of clusters and outbreaks where people are eating lunch in break rooms and not practicing the physical distancing when they take their mask off to eat. And so that's something to be aware of. Other questions to ask would be about gym, recess, PE, those sorts of things. Our school is modifying those activities to avoid close contact, doing things outside as best as they can, and focusing more on sort of wellness. Like, maybe we're not going to have contact sports in gym, but we'll do yoga, or we'll do some kind of stretching where we can, designate a spot for each kid to space out. So these are some of the questions I think parents should ask, and things that our school is focusing on. I think it's a lot depends on how we frame it. So I've had my kids at home, and I would encourage parents to do this, practicing wearing masks. So I do have a rising kindergartner and a rising third grader, and I've had them, okay, we're going to read a book inside and we're going to wear our masks while we read it. Or if you want to watch that television show, let's watch it, but we're going to sit inside for an hour and wear our masks, so they get used to wearing masks inside and for extended periods of time. My rising kindergartner currently at this moment is at a sort of pre-kindergarten warm-up camp that is for 2 hours today, and it was 2 hours earlier this week. And they're essentially having that to practice with the kids, get them used to wearing the masks outside when they're playing and inside. They're not taking them off so that it's not confusing. They are giving them mask breaks where they'll be outside and spaced out and can take their mask off. So I think there's a lot in that question. So to your point, in the older grades, middle school and high school, there is, like you're saying, you're not in your cohort or homeroom. You move between different subjects and different classes throughout the day. I think as long as physical distancing is happening as best it can, and wearing of face coverings is happening, and frequent hand washing, in theory, if everybody is adhering to that, the risk of transmission is still quite low. The mixing of people, what that introduces in my mind is a bigger complexity if and when there is a positive case of now we've got a lot of contact tracing to do because this one student has moved between 4 or 5 different classes throughout the day, and it's 15 kids in each one of those 4 or 5 classes as opposed to a smaller group. So I think thinking about contact tracing is slightly different than thinking about the actual individual risk. And for instance, I'm not always with the same cohort of people at work here every day, but because I wear a face covering, I try and physical distance when I come up to a new person, and I wash my hands and do hygiene frequently. Knock on wood, for now, I've been safe and been able to protect myself, even though I'm in different cohorts. So I think thinking about the risk of transmission really needs to focus on, again, physical distancing, face coverings, and hygiene. When you start to mix those cohorts, it brings up the worry there. Again, it's introducing new people, but which will increase the risk of transmission some. But if you're, again, wearing face coverings should be low, but it introduces a layer of complexity with contact tracing. Yes, so I have to admit this is a newer term to me, but I have become aware of this term. So my understanding is that there are patients who have had COVID that are self-identifying as long haulers, and what they mean by that, I presume, is that there is definitely a subset of patients who will have remaining, or let's say prolonged symptoms more than 2 to 3 or 4 weeks after infection, some lasting out 2 months, maybe 3 months after infection. The acute symptoms, best that I have read, go away. So the acute symptoms of fever, of myalgias, sort of the acute shortness of breath and cough. But there are some of these chronic symptoms that long haulers are describing that they're experiencing are more of chronic fatigue, chronic joint pain in some, chronic shortness of breath, especially if they had lower respiratory tract infection with COVID-19. And I think the fatigue is the main thing. To my knowledge and from what I have read, this probably, in my opinion, represents chronic inflammation, chronic immune activation from the virus. And there's precedent with other viruses, specifically EBV or the monovirus and cytomegalovirus or CMV, that there are a subset, and it's usually a minority of patients, so I don't think everyone should be worried about this. This is usually a minority of patients will experience a chronic, I just don't feel well, fatigue, sometimes ache for several months after they have a viral infection. And I suspect that is what this is related to. I know there's been concern about, does this represent that I still have the infection, that it's ongoing, that I can give it to other people? And from evidence and from what we know now, that is not the case. I would say there's evidence that people shed the virus and we can still detect it for several weeks after the initial diagnosis if we do the nasal pharyngeal test. However, if you try and take that virus and grow it in a petri dish or culture it, which would represent that it's live and can be transmitted from one person to the next, we can't grow live virus. So you're probably detecting old, dead virus in people's noses. So the chronic symptoms do not represent ongoing chronic infection that you could then transmit to somebody else. It's just, unfortunately, your body recovering very slowly from this viral infection. In general, for all viral infections and even other types of infections, there is always a spectrum of disease. And as time goes by and more people are infected, we realize there's always a spectrum. For most viral infections that I can think of, there is a spectrum from those who have it, who have no symptoms, to people who are very sick. It may look different. The spectrum may be skewed one way or the other for different viruses, different than COVID-19, but it's not unheard of, and it's fairly normal for there always to be a spectrum of any disease and varying responses in individual people. Why those responses in individual people are different, we don't 100% understand, and for COVID-19 we don't totally understand. There does seem to be some correlation between those who have fewer symptoms having lower and shorter lived antibody responses, and those who are sicker having more robust or higher levels of antibody production and maintaining those antibodies for longer over time. So the symptoms, so that what that sort of leads me to think is that the variation in symptoms is probably somewhat related to how an individual person's immune system is responding to the virus. And as we age, our immune systems change. Obviously, it's somewhat individual, it's genetic, and so there's all varying responses. And I would suspect that the variation in symptoms that we're seeing is related possibly to varied individual immune responses and reactions to the virus, and maybe also somewhat to the amount of virus that you're exposed to. I don't have the crystal ball answer to that. There is some interesting discussion about it's not only how many people get vaccinated, but do the right people get vaccinated? And there's some suggestion and evidence that there are certain people that are sort of more super spreaders. They may shed more droplets when they talk or eat or sing or aerosols than other people. And ideally, you'd want to vaccinate all those people. But from a public health perspective, you can't identify who those people are a priori and figure that out. In general, if we look at influenza, depending on how effective the vaccine is, you need to get to some proportion of the population. Again, and ideally it's vaccinating the right people who are at risk to spread it to other people to prevent, large enough community spread that it's sustainable. And so people throw out numbers like 50, 60, depending on the effectiveness of the vaccine, maybe 70% of people would need to be vaccinated to essentially generate enough of a population or herd immunity to protect the community as a whole. So what the right number is exactly, I don't know. I would encourage most people, once the vaccine is available, and I'm very premature in saying this because we don't have one that's approved or safe yet, but I'm optimistic we'll get there. I would encourage most people to go out and get the COVID-19 vaccine when it's available, but realize not everyone's going to be able to get it at first, because we're going to have to prioritize those who are at highest risk probably first.